In Japan, the word for pivot sometimes is used to refer to the most important organs of the body, for example, the liver or heart. The Chinese character could be read as liver, heart, pivot. Pivot to the muscles. Both are very effective. The number of points and pressure repetitions depends on the need of the individual patient. For receiving pressure kneading therapy, the patient should wear comfortable clothing such as pajamas or sweatpants, and the pressure kneading should take place on a mattress or similarly soft surface. When pressure kneading the lumbar regions of people who are overweight or underweight, old or very young, the chest should be supported with a pillow, and the pressure kneading done mostly vertically. And for example, if the patient has a misaligned left hip bone and the left lower part of the body is weak, the pressure kneading should be done primarily on the left side of the lower body. As the balance is restored in the body, the technique can be applied to both sides. Let me explain a little about the vertebrae and pelvic bones. In the spine, there are 7 vertebrae in the neck, 12 in the thorax, and 5 lumbar vertebrae. That's a total of 24 vertebrae. Also underneath, there's the sacrum and the coccyx. So there are 26 bones in all. And on both sides of the back are the shoulder blades. The upper part is called the region above. The lower part is called the region below the shoulder blades. And in between is the space between the shoulder blades. The pelvis is made up of the ilium or hip bone, the pubis or pubic bone, and the ischium. The upper part of the hip bone is called the iliac ridge. The back of the knee. The gastrocnemius, medial, and lateral head are the muscles centered on the calf which run from the knee to the ankle. The side hollow point of the top of the shin bone, down the outside of the shin to the ankle. The underknee point is located on the outside of the shin bone, right next to the knee bone. Now let's see how the pressure kneading and realignment therapies are done in practice, following the instructions in the book. The title number refers to the pattern number, or step, in the instruction book. When the therapy relates to both sides, we usually show only the left side, but you see the step numbers for both sides. So referring to the book, let's practice. The starting pose for therapy. At the beginning of the massage series, the therapist sits such that the patient's buttocks are held between his knees. Putting your toes under you gives you a more stable position. Preparation to adjust the neck vertebrae. Knead the muscles above the shoulder blades 10 times using both hands. Preparation to adjust the neck vertebrae. Using the thumb, pressure massage 5 points along the center of the neck, repeating 3 times. Pressure knead 5 points outside the spine, three times. Adjusting the neck vertebrae in sitting position. With the left thumb, press on the space between the 7th neck vertebra and the 1st thoracic. Adjusting the lumbar vertebrae on the left side. Taking the patient's left hand on her right shoulder, support her left shoulder from behind. Turning her body to the right after taking up the slack, give a quick push to realign the vertebrae. Adjusting the lumbar vertebrae on the right side. Adjusting the tarsal or ankle joints. Grasp the tips of the patient's feet with both hands and, using your own body weight, push them into the buttocks. After taking up the slack, give a quick, stronger push to crack the joints. Adjusting the toe joints. After cracking the ankle joints, while letting the feet return to their normal position, crack the toe joints with a wrist motion using both hands. Pressure kneading the sacral region. Using both thumbs, press and knead vertically on 5 points in the sacral region, repeating 3 times. Pressure kneading the left buttock. Massage the left gluteal muscle 10 times with your left palm. Pressure kneading the region above the left trochanter. Using both thumbs, pressure knead the muscles of the trochanter area 25 times. Pressure kneading the crease under the left buttock. Pressure knead 10 times with both thumbs, aiming at the pelvic nerves. Pressure kneading the left femoral biceps. Using both thumbs, pressure knead 8 points along the back of the thigh. Moving your center of gravity forward, use your body weight to push her feet down towards her hips, finishing with a sudden jerk. Kneading the erector spinae above the shoulder blades. Pressure knead 10 times on each point in the area above her shoulder blades with your thumbs. Pressure kneading the erector spinae from the shoulder blades to the lumbar region. Shifting your position to maintain vertical pressure, massage the muscles on both sides adjacent to the spine, twice each in 10 points from above the shoulder blades, down through the peaks of the hip bones. using hand pressure on the lumbar region. Knead the area above her hip bones 5 times with your palms. Then, in the same area, press repeatedly next to the spine with one hand on the other. Pressure kneading the left trapezius and shoulder. Pressure knead with your left hand and the left deltoid muscle 10 times. And at the same time, with your right hand, massage the left trapezius. Pressure kneading the area above the shoulder blades. Taking both knees into your hands, fold them back until they touch your chest, using your body weight. Extending the hip joints. With the soles of the patient's feet, massage 8 points along the shin bone twice each, using primarily your thumbs. Stretching and pulling the extensor muscles of the left leg. Resting your right elbow just above the patient's left knee, hold her left heel with your left hand, putting her toes under your forearm. Pull her here towards you 3 times, holding her knee down with your elbow. knead twice in the middle and once each on either side. Adjusting the left elbow joint. Hold the patient's left wrist in your right hand and raise her elbow with your left hand while bringing her hand down with a jerk to stretch the elbow. Adjusting the right elbow joint. Adjusting the left wrist joints. Hold the patient's left wrist palm down with both hands and jerk the hand up twice. Adjusting the right wrist joints. Pressure kneading the left forearm. Hold the patient's left wrist in your left hand and twist her forearm outward while kneading 6 points along the forearm, twice each. Root of the left thumb and index finger. Knead the delta-shaped web between the thumb and the index finger 5 times with your thumb. Stretching the left upper arm. Hold the patient's shoulder at her armpit with your left hand, and with your right hand push her elbow toward the floor over her head, pulling the neck bones. Holding the patient's shoulders with both feet and her neck with both hands, pull her head towards you in 2 quick jerks. Before moving on to step 88, it's a good idea to use a cloth or towel when pressure kneading the head. Pressure kneading both sides of the nose and below the lips. Massage the sides of her nose 5 times with both thumbs. Pressure knead between the chin and lip 5 times. Massaging the upper and lower ridges of the eye sockets or the temples. Massage 4 points along the ridge of the eye sockets twice each. With your thumbs, pressure knead the temple 3 times. Pressing the eyeballs. Using your finger cushions, lightly press the eyeballs 3 times, holding it each time for a second. Squeezing the face. Lock your fingers together over the patient's upper face and apply moderate pressure to 3 points along the sides of her head above the nose. Pressure kneading the median line of the head. Massage the forehead, kicking the back. With your knees on the patient's hips, slowly fall back, pulling her shoulders with you. Hold this back-breaking pose for 3 seconds. Adjusting the shoulder joints. Supporting the patient's back with both hands, jerk her arms upward, stretching her chest. Hold the patient's wrists and lift her hands behind her to her shoulder level. Then bring her hands closer together 3 times. Pressure kneading the area above the shoulder blades. Standing behind the patient's back, press 10 times with your thumbs in the area above To effect real healing, treating the symptoms is not enough. It's necessary to eradicate the root causing the sickness. Hip bone Yu-Mei-Ho is a therapy to correct mislocated joints, not only in the pelvis, but also in the whole body, and to put the muscles back into balance, and in that way maximize the body's natural ability to heal itself. I hope that you can properly understand this video, and that every day you will enjoy a happy and healthy life. And it's my wish that as many people as possible who are sympathetic to the ideals of the hip bone Yu-Mei-Ho will become instructors and contribute to spreading this method of natural healing. However, I cannot be responsible for any accidents that may happen during its practice. The hip bone Yu-Mei-Ho therapy has an apprenticeship program to train practitioners. Please contact the International Institute of Preventive Medicine in Tokyo if you're interested. Information about this hip bone Yu-Mei-Ho therapy is already available in a dozen languages, including English, German, French, Russian, Chinese, and Esperanto. Those who use the therapy and benefit from it hope that it will become widely known, so that as many people as possible will be able to use it to regain their health.